So, hello friends, today we are going to deal with the topic infection. This is the introduction chapter to the infection control and safety. So, firstly, you can see there are some common definitions. So, we can go through by one. So, firstly, you can see infection. Infection is nothing but the microbes or microorganisms that enter to the host body is known as infection. Next, you can see infectious disease. Infectious disease is nothing but the microorganism that enter to the host body after the entry of microorganisms that causes abnormal or changes in the body and cause the disease is known as infectious disease. And next, we have parasite. Parasite is nothing but the microbes that can establish themselves. The microbes that can establish themselves and multiply in the host is known as parasite. So next we have saprophytic. Saprophytic is nothing but it is a free living microorganisms that that is present on dead organisms, and this type of microbes helps in decomposition of dead bodies. And next we can see commensal. Commensal is a microbes that live with the host in complete harmony without causing any damage. Example, Streptococcus salivarius and E. coli. Next we can see opportunistic pathogen. Pathogen that is normally safe, but when host immunity is lowered, they can be dangerous. So such microbes are having some examples such as bacillus bacillus, streptococcus sp. So these are the two common op- example for opportunistic pathogen. So next we have types of infection. So in the infection there are some types. Firstly, we can see primary infection, reinfection, secondary infection, focal infection, nosocomial infection, heterogenic infection, endogenous, exogenous, subclinical, atypical, latent, local, and systemic. So we can go through one by one. So firstly, you can see here primary infection. Primary infection is nothing but exposure of pathogen for the first time. So if you undergo a pathogen for the first time, it is known as primary infection. Next we can see reinfection. Exposure of the same pathogen for second or many times. So if we undergo same disease for multiple times due to the particular pathogen, it is known as reinfection. So next we have secondary infection. This is denoted as the infected by a pathogen, immunity lowered and cause invasion by other pathogen is defined as secondary infection. So next you can see focal infection. Focal infection is defined as a localized infection that shows the signs and symptoms or pain in other regions. So next we can see nosocomial infection. So as everyone know, nosocomial infection has other name, hospital acquired infection. Hospital acquired infection also is known as nosocomial infection. So this denotes a person make a hospital visit for a treatment or etc. And immunity is low and gets infected by other hospital microbes. So example, wound sepsis. Wound sepsis is nothing but when we undergo any wound treatment. So the bacteria that present in the hospital may enter through the wound and cause infection. So this is known as nosocomial infection. Next we have iatrogenic infection. Drug induced infection during the course of treatment. Example, muscle sepsis caused by a unsterile equipment used. So next we can see endogenous infection. When a commensal enters places it should not be. Entrance of E. coli to urinary tract can cause infection. So endogenous infection occurs from the patient's own flora. Endogenous infection occurs from patient's own flora. So next we can see exogenous infection. Exogenous infection is nothing but it's a cross infection. A pathogen or a infection that is transmitted from one person to other person. Example, from staff nurse to patient, or from patient to staff nurse, or from patient to patient. This is known as exogenous infection. So next we can see subclinical. It is a type of asymptomatic infection. So in this you cannot identify any symptoms. Next we can see atypical infection. Symptoms are atypical. Next we have latent infection. Latent infection is nothing but parasites that remains in tissue in a latent or hidden form, proliferating and producing a clinical disease when a host resistance is lowered. Example, herpes infection. Next we have systemic infection. A spread throughout the body is known as systemic infection. Example that which causes systemic infection is known as streptococcus infection. This is the bacteria that which causes the most common infections. So here you can see the source of infection. You can ask why how the infections are transmitted from one person to other person. So there are some common vehicles that how the infection can be transmitted. So firstly, we have humans. So from the humans, the infection can be transmitted, and next from animals and vectors, insects, food, water, soil. So these are the common sources that infection can enter to other persons. So firstly, we can undergo for human as a source. So human acts as a carrier, a person who harbors the pathogenic microorganism without suffering any ill effect because of it. So there are types of carrier. Healthy carrier. Healthy carrier is nothing but the patient never get infected. Convalescent carrier. The one that recovered from the disease is known as convalescent carrier. And next we can see temporary carrier. Less than 6 months is known as temporary carrier. And chronic carrier. The word chronic itself denotes for a long period of a time. So several years or the rest of the life. Next, other sources of infection transmission. Patient. So patient when they go under contact and they as a carrier, someone who acquires a pathogen from a patient is known as contact carrier. Next we have paradoxal carrier, someone who acquires pathogen from a carrier. So you can see the difference. The contact carrier is nothing but the pathogen from patient. Paradoxal carrier is nothing but a pathogen from a carrier. So next we can see animals. So animals also plays an important role in causing infection. So firstly we can see zoonosis. Zoonosis infection disease transmitted from animals to humans. So zoonosis could be bacterial, examples such as plague from the rats, and viral rabies virus from the dogs, protozoal toxoplasmosis from the cats, helminthic hydatid disease from the dogs, fungal zoophilic dermophytes from the cats and dogs. So these are the common animals that which can cause the infection transmitted from animals to humans. So next we can see insects. Arthropod-borne disease, a disease caused by a blood-sucking insects. Vectors, insects like mosquitoes, ticks, mites, flies, fleas, and lice. So these are the common vectors that which can transmit disease from one person to other person. Types of vector, mechanical vectors and biological vectors. So first we can see mechanical vectors, transmission of dysentery by flies. So dysentery can be transmitted by flies is known as a mechanical vectors. Biological vectors is nothing but anopheles mosquito in malaria. So anopheles mosquito is nothing but a female mosquito that cause infection to the human through sucking a blood. Next we have extrinsic incubation period. Time of entry of a pathogen into the vector and the vector becoming infective is known as extrinsic incubation period. Soil. So soil has some of the fungi. Example Histoplasma capsulatum and parasites examples such as hookworm and roundworm. And infection can be transmitted by water also. So the contaminated with pathogenic microbes. So some of the microbes that which are present in the water. Example cholera vibrio, infective hepatitis virus. And infection also can be transmitted through the food. Contaminated due to the external contamination or pre-existent infection in meat or other animal product. So you can see here modes of infection. Contact by direct and indirect. Next we have inhalation. Next we can see ingestion, inoculation and congenital transmission. So types of infectious disease. We have endemic infectious disease. Endemic is nothing but constantly present in a particular area. So it denotes that the infection that occurs in only some regions, is known as endemic infection. Epidemic infection is nothing but spreads rapidly and infect many persons in an area at a time. So it occurs in some more large space like community, etc. Pandemic is nothing but epidemic that spreads through the many years of the world and very large number of persons in short period of time. So in less period of time, many people will be getting infected. So that is an example of pandemic infection. So you can see a COVID virus as the best example for pandemic infection. Next you can see prosodemic infection, creeping and smoldering epidemics. Next, we can see sporadic infection. Thank you. So, by this, we can end this chapter. And next, we can see the actual content of infection control and safety one by one.